One of the most crucial parts to a pediatric office is administering vaccines. The average office provides over 4,000 vaccines in a year with over 5,000 vaccine admin codes, which makes having a reliable system to monitor and track vaccines, as well as a capable billing company, vital to the success of a pediatrician's office. When the vaccines are delivered to the office, it's important to first manage the cold chain. Pediatric offices should always make sure to correctly store vaccines once they arrive in a satisfactory storage system that can be continuously monitored. In the Physician Express system, the barcode from the packaging can be scanned in order to transfer the information to the system, or data on the CDC-approved vaccine can be entered by selecting from a drop-down of the available vaccines. This data information includes the NDC code, manufacturer, lot number, expiration date, as well as other vital information. Once the inventory is entered into the system, the number of doses per vaccine will be shown in real time to allow an accurate depiction of available stock in storage by the practice. During a patient visit, the system allows a provider or appropriate staff member to order a vaccine so a nurse or medical assistant can record the vaccine given during the visit. This includes the ability for the medical assistant to select the exact vaccine to be administered by scanning the barcode or selecting from the available inventory available at the office. Using the information from the inventory allows checks to be put in place, like prohibiting the ability to select an expired vaccine. When charting a vaccine, the vaccination record will be updated in real time along with all detailed information like CPT codes and NDC codes and attached to the patient chart. Since the CPT code was collected from the administration of the vaccine, the codes are readily available and accurate to what medical billing needs to submit. Without having an optimal billing process that collects at 99% of the contract amount, a pediatric practice can lose money on the reimbursement of vaccine CPT codes. Physician Express helps to ensure that the correct NDC numbers and diagnosis codes are used in order to comply with insurance submissions. The information collected from the patient demographics, previous vaccine records, and in-office administration of vaccines allows for a report to be made that shows which patients need which vaccines based on the practice's vaccine schedule. Along with up-to-date inventory input, the system calculates and informs the pediatric practice of which vaccines need to be ordered to have an accurate supply that meets the demand without purchasing significant excess. This provides an opportunity for the pediatric practices to increase their vaccination rate and improve prevention across their practice in a way that maintains or enhances profitability. The database for the vaccine management system allows for ease of use in many ways. Physician Express takes the CDC database and CPT codes and simplifies them for the user. There's no need to manually input CPT codes or track down CVX codes in our vaccine management system. The database also hinders the disconnect between reimbursements, costs, and actual inventory since every step of the vaccine management can be tracked through the system. With many different vaccines, many payers, different families, multiple offices, and multiple staff members that have to be accounted for, the monitoring and management process should be streamlined. Physician Express provides a well-designed pediatric EHR system that mitigates most risks and associated burdens for pediatric practices. In order to achieve effective pediatric vaccine management, there must be a proper system to monitor and manage the vaccine process. Pediatric Express offers an end-to-end vaccine inventory system where you can keep track of the inventory of vaccines received and input vaccine details into the patient record. This also means that the system was constructed with coding, billing, and reimbursement in mind. With the reporting systems incorporated, the practice receives an annual report that provides the actual revenue of vaccine payments received above cost. All pediatric practices should have a process to identify issues that may come up, such as an out-of-network payer, a vaccine that is being billed at a rate below reimbursement by the highest reimbursement payer, and so forth. Many pediatric offices have gaps in their process, reporting an approach for which the practice owners are unaware of the profitability of their current approach, as well as gaps in patients that are due or missing pediatric vaccines.